Hi friends, this is Dr. Siva Kumar, orthopedic surgeon, Care Hospitals, Hyderabad. Knee osteoarthritis, that is the knee pain. Should we go for knee replacement? Should we go for PRP plasma therapy? Let us clear the confusion. Here you see a stage 2 osteoarthritis. So there are 4 stages as per the X-ray. Mind you have to take the X-ray in standing position. 4 stages. Stage 1 of course is very mild, just minimal painkillers and some rest, it will cure. Stage 2 is little more severe, around 20 to 50% of the knee erosion happens. Here, PRP plasma therapy works. But mind you, it is not 100% cure. Around 40 to 50% you will get a relief. Some patients may get less, some patients may get more. But remaining 50% of the pain relief comes from physiotherapy, exercises, weight loss, sunlight exposure, proper dietary changes, and having a good lifestyle basically, rather than much of medications. If you go to the next stage, so in the stage 3, where the knee osteoarthritis is around 50 to 70%, here you see the joint space has decreased even more and the bulges in the bone edges have increased even more. They are called osteophytes. The osteophytes are larger in size. This is around 70% of the osteoarthritis. In this stage also PRP and plasma therapy works to some extent, but not much, maybe 20%. Some people again less benefit, some people get more benefit. But remaining 75% is essentially medications, physiotherapy, exercises, lifestyle changes, sunlight exposure, proper lifestyle. And here comes the last stage. This is stage 4 of osteoarthritis as per the X-ray. Here around 80 to 90% of the knee joint is eroded. You can see bone on bone erosion, complete bone on bone rubbing. The cartilage and meniscus shock absorber, everything have gone. And you can see many osteophytes, multiple osteophytes. In this stage, PRP doesn't work much. Even it works maybe 10%, 20%, temporary relief only. But in this stage, the real treatment is knee replacement. Mind you, there is a role for knee replacement, there is a role for PRP. But some people say we still have some complaints after knee replacement surgeries from the patients. That is why, because you don't do proper exercises before going for surgery. So you have to do some simple exercises in the physiotherapy department before going for surgery. For example, if you have surgery scheduled for knee replacement, take at least 1 month to 2 months time, correct your vitamin D, B12, correct your diet, have a proper sleep, correct your bowel movement, do proper pre-surgery exercises, and then only go for knee replacement. Then you will not have any problem. So knee replacement is very, very successful surgery, little preparation and proper indication only in last stage. PRP works in early stage very well. Thank you. All the best. Consult your doctor before taking a decision.